Welcome to the Dr. John Char Holistic Health Show. On the last show, we showed the topic of facial aesthetics and anti-aging. We're going to continue this in more in an advanced stage when we're going to show you what we call the gummy smile and how you can immediately correct that, as well as spaces between the teeth. But first of all, let's get a summary of what we'll be talking about today. In the last show, we told you about the different folds and different wrinkles in the mouth and around the face and in the forehead. So it's all through expression or motions in action. We call that dynamic action of the muscles. So if I frown, like give you an idea, if I go ahead and lift my eyebrow up, you're going to see a lot of the folds right in here develop. Okay, those called the frontalis folds muscles. And then you can see that if somebody squints, you can see, even blink the eye, you're going to see what we call crow's feet, wrinkles around the outside part of the eye. And then if you go ahead and lift your eyebrow like you're surprised, you're going to see a different thing, and a lot of times you're going to see folds in between the eyebrows. And it's called the glabella, like this, and frown, or the angry look, or the worried and frown look. Then you can even actually, if you smile, you're going to see a different type of wrinkles come out, usually around the cheeks area, deep into the nasolabial fold, even in the part of the around the mouth, and you can see that you call pre-jaws, where the muscles are sagging down towards the angle of the jaw. Okay? And if you smile, again, a lot of times you're going to see gums up here. You're going to see a lot of gums showing there, just like the former Olympics skater, Christine Yamaguchi. When she smiles, there's all gums up here. Okay? And then you can even see black spaces between that, the teeth, and that's kind of, you see that after an orthodontic correction. After several years, you had your braces off, and all of a sudden you start to see the spaces between the teeth. It's not very cosmetically pleasing. Or you're going to see after an implant, a dental implant, meaning on the front teeth, you're going to see that the gums don't quite go up between the teeth, and there seems to be a black space between them. We're going to show you how we can correct that immediately. So let's go to the first slide. We're going to show you some of the different slides so you can see what I'm talking about. Okay. So when we look at this, we can see before a gummy smile. Notice that by the cheek, you can see deep folds coming around by the side of the nose, and it comes down to the corner of the mouth. And in the corner of the mouth, you see a small little wrinkle is facing down. I'm going to show you what we need to correct. And then also, you can see on the left side of the face, you see a line going from the corner of the mouth, and it goes all the way to the jawline, okay? And that's called jaws, okay? A lot of times when you pucker, you're going to see we're going to show you a picture later on how when you are in pucker, you're going to see little pucker amounts of cobblestones on the point of your chin and in the neck. So next slide. And there, that's been corrected. So you can see that, you see the lip lines covers the height of the front teeth. So that's after a correction. And the line of the upper lip is a little more refined, where it's straighter. It's not like one side's higher than the other. And this side, you can see that the nasolabial line right along the side of the nasum or the nose, you're going to see it's not as deep. And also the line going from the corner on the left side of the face, it comes down to the jaw angle or the jaw bone. You're going to see that it's not so deep. Next. So that's been corrected. Here's another gummy, this is another smile, and you can see that the lips are, so look at the next slide. Okay, and you can see that the lips have dropped down. So go back to the first slide again. Previous slide. Okay. So Yeah, okay, now you can see there's some gummy line there. You can see around the mouth, you can see the wrinkles. You can see the wrinkles by her lower part of her jaw coming down from almost like the cheek line coming down to the bottom. And she means that in the cheek area, you're going to see some fat been lost there in the cheekbone. And also some even bony structure. People with osteoporosis or osteopenia might have some of the problems there. And then so all the weight of their muscles is going towards the chin line. And you can see that it starts to sag. Okay, go to the next slide. Okay, and so therefore, if you look at this picture here, you're going to see how beautiful results with full corrections. So it's not just working on the mouth area and helping with the gummy smile, but it's also helping. You have to look at the whole face. You look at the cheek, you look at the chin, you look at the side around the commissures, means on the edges of the lip. You look at the neck. So those all has to be considered when making a correction in making a nice full lip and helping with the gummy smile, preventing the lip from retracting all the way up towards the nose. And you're going to see less teeth, and less gums. You see just on the neck of the front teeth. And it has a nice smile. You see the upper lip is a lot straighter. It's not like bumpy, one size higher than the other. Next slide. And you can see right here, you see look at the cheek area. It's called the nasolabial fold. You look at, this is more severe case on the left side before. And you can see that the jaws on one side, you can see that the line is going straight down to the border of the mandible. And you can see that it's deep. On the opposite side, after, you can see that the nasal lines along the side of the nose is more filled. You can see a little more contour on the upper lip. You see like a cupid right in the middle. You can see it. It has a more fullness there. It should be 2/3 the size of the lower lip. And you can see that on the edge of the mouth, you see a line going straight rather than on a before slide. You can see the lines on the end of the mouth. You can see it's going down. And the lines going towards the jaw area, it's almost disappeared. Okay, next. And that's after correction. So therefore, now we're going to see lower face injections. So these injections are very tiny. They're like 1/10 of a millimeter. And it's really small. And it's a very small needle. It's like an insulin. So you really feel it, just like a prick mark. And you can see on the right side, you can see again, the skin is rough. And on the top scale, on the bottom, you can see a lot of wrinkles on the upper lip. And on the bottom, you see even on the lips line, you can see a lot of lip wrinkles there. And that can be corrected. Okay, next. And then you can see on the left-hand screen, you can see a deep fold again. And you see on the pretty gal on the right, you can see that a little dot here on the side. That's where we put that Botox injection, or they put dermal fillers in there to give fullness to the face. And the Botox injections we use non-active bacteria, so it's not going to cause you that side effects. Maybe only 1% of 1.4 million people had some kind of effect from it. And so you can see the one on the lower, you see how the body has, over the ages, she's lost some collagen, she's lost some bulk in the face, like fatty tissue, and then the whole side of her jaws on the lower right picture, you can see it's dragging towards the mandible. Okay, and then you see a little dot there on a model. You can see where they actually will put one small little drop of Botox, or they call Dysport, and it has some proteins in there, and it would actually help to relax the muscle there, and then the muscle will look more full, and you can fill it up, what we call dermal fillers, and you can make the face look more full rather than sort of like sagging or bony. Okay. Next slide. And you can see there is a picture of a face. You see the upper lip. It's a little thin. It looks pretty good over there. You look at the wrinkles on the side of the nose. It's pretty well gone. But she doesn't go through a facial expression. So this is at passive, means at rest. And when the person goes into action where they're actually moving their muscles, then the wrinkles will appear more dramatically. But you can look at the upper lip right now. It's very thin. And that should be a little thicker. So you can enhance that and give it more fullness through that we call body fillers. Next. And then you can see right now as the patients rest their teeth together, you can see a space between that. On the upper left and on the lips, you can see a little space and little thinning there of the lips. So with fillers now, you can actually do that in one appointment and come out looking really even. You can see that the upper lips will give more fullness and more contour. Next. And then you can see right here that after you did a correction or a body fill called dermal fills, you can see the upper lip is a little straighter and give you more fullness. And you can see the wrinkles on the sides going down to the jawline is pretty well filled in. Okay, good. Next. Now that's one of the things. You see that's called an insulin syringe. And every hash mark you see there, it's like 1/10 of a millimeter. And so it's very tiny. And so it's such a short, sharp needle, you rarely feel any kind of pain. So next. And there's another one they're putting into the lips to give fullness to the lips. And that will actually, when you walk out of the office after you finish that therapy, it might take you 20-25 minutes, and you can see a dramatic change in your face, a youthful look, a more even look. Next. And there you can see on the side. So you have to know your landmarks. You have to know where the muscle meets. So not anybody can do this. You have to get some training. And dentists are getting trained because they know a lot about the muscles in the face, and MDs and nurses. These are people that can legally do it. Okay? And you can see in the corner of the lip, they're just putting some fillers there. Now here's the one that you see the person on the right hand of the screen, he's puckering. And you can see what we call cobblestoning effects. And you look at the chin, it's all like cobblestones. We'll show you what a cobblestone look like. And on the right, on the opposite side, you can see that's had some fillers on the chin, and it's kind of filled up that little cobblestone effect. And you can see that the muscles on both sides of the chin are a little more full, so you put some fillers in there. And you also, on the top of the lip, you can see that the wrinkles almost disappeared. Okay, so next slide. And this is a cobblestone effect. So you don't know what a cobblestone effect is. That's what's the look when a person has lost fat and they lost collagens in the chin, and it will look like a cobblestone effect. That's a cobblestone effect. Next. And then you can see right here, same thing in a cobblestone. You see the two dots where you actually put that little fillers in there, and the Botox and the fillers in there on the chin. Next. And you can see also, when you have these puckering effects on the chin, it also can translate to the muscles of the neck called the platysma. On the right side of the screen, you see the little marks to be put in there. So it's where the Botox is inserted to relax that muscle. And you look on the opposite side, it's pretty well cleared. So when you have this chin and a gummy smile and the jaws, it also creates a lot of times the neck muscles to stretch out, and the superficial muscles. And it won't create a problem with your breathing or anything because those are superficial muscles. So next slide. And you're going to recognize this as a beautiful girl called Angelina Jolie. You see how long her neck is, and her jaws are a little square, you see, but her lips are really luscious, and you can see the forehead's really nice and no wrinkles and things like that. Well, she might have had those corrections or the enhancements into her muscles and her spaces in her face. Next. And then you can see right here a combination of these Botox injections with which are used to relax the muscle. And then the fillers were used to take in the wrinkles and fill up those gaps. And you can see one side on the left side, or right side of your screen, you see a gummy smile. On the left side, you see the lip has dropped down, got more relaxed on the upper lip. You get some of the creases on the side of her nose are less pronounced. And then look, the chin is a lot more full. You don't see the wrinkles. And it's the same person with the smile. See, so combination of the fillers and the Botox. Next. And you can see a beautiful model there. And you see how radiant her looks when she smiles. She's smiling and you don't see the wrinkles. And you can look at the mouth and you can see the upper lip. The upper lip is at the height of the front teeth, the neck of the front teeth. You can see, look at the forehead, look at the sides, and that's how you want to look like, a youthful face. Next. Another picture of a model that's been had her face corrected, and you can see a little bit folds just on the side, the smile lines right on the side of the nose. But you notice that the lips are kind of full, it's straight across. Notice the lips, upper lips, and the lower lip. Remember, the upper lip should be 2/3 the size of the lower lip. To look at the forehead, you don't see any lines there. You don't see any crow's feet there on the side of the eyes. Next. And another model. And you can see how nice those are. And these models have had some therapy there. And you see a little bit on the neck. You can see a little bit stretch on the neck. You see that the line coming through is that muscle there. And so that can be corrected. And so beautiful smile all the way back. You can see that you don't see any gum line when she's smiling. Next. And now we're going to be talking about spaces between the teeth. Remember I mentioned that you can have spaces after you had your orthodontia done and the teeth be moved around, you had your braces off, and now you're ready to go without braces. You have a retainer on, and all of a sudden you look at the spaces between those teeth. You can actually fill it out. We're going to show you how we can fill those out. It will last about a year, 2 years, and you can bring the height of the gums up higher, so aesthetically pleasing. You look at and when you smile, it gives you a full look. Next. And this is what you'll be doing now, and you can see that it's between the teeth. You can see all the spaces between the teeth, and you can go all the way to the back teeth, but you know, the front teeth especially doesn't look good, especially if you had an implant or a crown and all of a sudden the gum shrunk, and then you look beautiful crown, beautiful teeth, but you got the ugly spaces between the teeth. Next. And then you see how we do it. We just very small insulin needle. You see a number 5 there. You're taking even less than one increment of there. So you're not going 5, you might go less. And then you just put it lightly in the gums. It doesn't hurt. Just like you have dental, it's less than the prick or feeling of slight pain when you have an injection for a dental procedure. And you put it between the gums. You're going to mold it, and you can bring the gums down. You want to get a pointed space there, but you got a fullness there that will cover some of the spaces up there and make it really look good. Next. And then you can see right now, this is after all the treatment's been done, and this is right after the treatment's been done. And this is when you walk out of the dental office or the physician's office. If he does this, you're going to see that the spaces are pretty well closed up, and it'll give you a nice look. Next. And so, what do we use? There's all kinds of materials you can use. The whole thing we've been using for the last 20 years is Botox. And everybody said, wow, Botox is poisonous. It's a neurotoxin. We call that now neuromodulators. And they have very little side effects. If you have a lot of allergies, all kinds of allergies, of course, then we have to be a little more careful about that. But this is one of the kind of things that right now, when you talk Botox, they have different types of materials now called neuromodulators. And Dysport has less Botox in there. You also less proteins in there, and it's more softening look, And then they have a new one called Xeon. Xeon also is almost no proteins in there. It's a synthetic. And all those are used to relax muscle. Next. There's one called Radius, is a new product out, and it's a filler, and it has calcium hypatate. And what happens is that it helps to generate collagen in the tissue. It has collagen. It's the only one that has collagen, and those are called fillers. And they volumize, means they add into the spaces that are void in the face. And these are really good products. So those some of the things they're using out in the marketplace. They're using Germadil, Germadin, and that's used also. Just depending on what company, and each one has a different role. So depending on how which one you use has a different role, because that one has more hyaluronic acid, Juvidin. And Juvidin has more hyaluronic acid. It helps you to hydrolyze the tissues, give you more moisture in the tissues. Well, this one here, Radius, has more calcium in there and collagen. That's the only one that has collagen. There's only 6% collagen in your muscles, and so it helps to do this. And collagen is used to like cement the tissues together. So when that breaks down, you start to get wrinkles. Next. And there's another called Restylane. Restylane is also another product. Then you can they use this for injectable gel and helps you with building up around the lips and the corners of the mouth, fills up your chin. So it just depends on what you want to use up there. There's all different types. So it's up to the doctor to be able to select the ones just customized for your particular problem. So when you look at the face, you only can't look at one part of the face. You have to look at the overall. You're going to know where your muscles are, which ones are tight, and you have to be able to analyze it, called a facial analysis. Now, look at my face. I need some work too. Okay? It's a smile. You can see the wrinkles here. And those are going to be filled in. You're going to put maybe a Botox injection or a Dysport injection here, and not in the... And it will actually relax this muscle, and you won't see these creases coming down here again. Okay? And then the pucker like this, you can see little pucker lines here. It will soften this up, fill this area up, and then with all that, and because you remember now, as you get older, your skin gets thinner. And especially if you're Oriental and you have thin skin, or your structure is very narrow this way, maybe you get a forehead, my forehead is wide and it's maybe narrow. So the doctor, with his training, should know basically how much dose to put in here to make it more lift up. And maybe your eyes are lower and your eyebrow like droopy eyes. He might lift this eye up, or eyebrow up, and give you a more youthful look. He might correct and balance the eyebrows, with maybe eyebrow one side is higher than the other. And we call that balancing your face symmetrically. Now, not everybody is going to have a perfect face. Nobody has a perfect face where one side is perfectly symmetrical to the other side. But you got to go ahead and do some enhancement and give you a better look. And it will give you more confidence. You feel better about yourself. And you feel like you got youth back into your face. And it can be done practically for anybody, except if you have some kind of muscular dysfunction, or multiple sclerosis, or myasthenia gravis, or things like that, or ALS. Then of course you have to be, you can't do it on those people. But you see, so now there's a lot of things we can do for facial beauty. And you might have to have maybe around the eyes, if the skin is too baggy here, you can't get it corrected. That skin, I mean, that saggy skin. You might have to go to a plastic surgeon and do a really simple type of pullback, and then you can fix the face up instead of maybe have plastic surgery all over. You might have just spots here, do it here, spots. And then what you can do is enhance the body, enhance the face, and take these wrinkles off and make you look. It'll bring about 10, 15 years of youth back, look back to you. So this is what I want to be able to pass on to you, that now people can really feel good about themselves and having it done. So that concludes what we're going to be talking about. And we're going to do more, because the next show I'm going to be telling you how we can improve this by doing some holistic things like massage or different types of craniosacral work, and then to really make this correction that the doctor did last longer, and you feel better. The whole muscle will be looser for a longer period of time, so you don't have to have immediate corrections. So look at our show. I mean, our show is the first Wednesday of every month at 6 p.m. and every Thursday morning at 10 a.m. And so if you have any questions, be sure to give me on my email. It's you see my email will be listed as we close the show for acknowledgments. So until that time, it was nice talking to you and sharing the information that now you can go and seek out a health practitioner who does this and be able to make some choices, whether you want to do it naturally or you want to just do it all different types of drugs. We offer basically the natural approach. We love the natural approach. And so this is what we have. Till then, mahalo and see you again.